Now, people living with HIV, tuberculosis, and other health conditions who depend on Global Fund donated medications are to wait for an additional 2 weeks for the cleared health communities to reach them. The spokesperson for the coalition of CSOs in health, Enesa Moabing-Otin, says despite completing all customs documentation, logistical challenges are slowing the process as only 16 containers can be cleared per day. He estimates it will take an additional 2 weeks to cut all containers to their destinations across the country. According to him, although some medications have been shipped to regional centers, the Food and Drugs Authority is yet to certify 2 containers containing injectables. Listen.
Though the clearance has been given for all the containers to be removed, there is the challenge of how many trucks can be offloaded in a day. Under normal circumstances, the Central Medical Stores offloads 8 trucks a day. That is their routine. But under the current circumstances, they are now forced to do a maximum of 16 a day. So that means that it's going to take some time for them to be able to cut all the containers from the ports to the warehouse. So technically speaking, the GRA and all the other port authorities have given a go-ahead for the commodities to be cleared, except that for logistical reasons, it's taking some time for them to be carted to the warehouse. This week, they explained that they are receiving 70 containers. So they have made provisions for those 70 containers. Earlier, they had received 64 containers. That was a week before. They had received 64 containers. And in the coming week, they will also be expecting to receive another 64 containers. So by their projection, within a maximum of 2 weeks from now, they should be able to get all the containers from the port to their warehouses.
I've been joined by the spokesperson for the coalition of CSOs in health, Enesa Moabing-Otin, for more. So what exactly is the situation as we speak? Has there been any improvement on what you've been talking about?
Okay, thank you very much, and a very good afternoon. So as of this morning, the updates we have received is that the clearing is still ongoing. The Central Medical Stores is still receiving the containers. There was some 9 containers that we were expecting yesterday, and they were delivered as of yesterday. So starting from today, they are expecting another set of 70 containers to come in. This will take them up to next week. And then the week after, they're expecting a last batch of 64 containers. And then they'll be done with the exercise.
You said that there are 2 containers that the FDA is yet to certify for use. How long is this going to take? Has the FDA told you when it will do that to allow the drugs to be used?
So this was information we picked out from the warehouse, that all the medicines that came in, they were certified by the FDA, and then they were released to go to the various regional medical stores, with the exception of some 2 which they are still looking at. And once they give the go-ahead, they will be also dispatched to the regions. But we don't have information on that as we speak.
Enesa Moabing-Otin, I'm grateful for your time. He's the spokesperson for the coalition of CSOs in health. There's more. We'll be following up on the story and we'll bring you more on that. The latest Ghana Human Development Report is warning that the country's health system could worsen if immediate steps are not taken to check the mass exodus of doctors and nurses trained in Ghana. The report says that so far 24% of nurses trained in Ghana are currently working abroad owing to poor working conditions. The case is even worse for doctors who were trained in Ghana, as 50% of them have also left. The document authored by the UN Development Programme in partnership with the Statistical Service and the National Development Planning Commission, says the health sector is in a precarious state due to this development and will require policy and pragmatic measures to avert a total shutdown of the sector. Head of the Diplomatic and Foreign Affairs Desk, Blessed Soga, joins us with more on this. Blessed, right before we speak with you, Blessed, let's listen to the warning.
Our current HDI is 0.668, which is indicating about a 0.015 difference between the indices that we recorded for 2020 and 2021. So one could look at this from the perspective of the fact that we are seeing an increase in our Human Development Index based on the indicators for its computation.
There's a portion that I read which is very striking about the health sector and what's happening to our health professionals. 50% of doctors, as we understand, who have been trained in the country have left the country. Nurses, 24%. How troubling is this, continuous exodus of health workers, and how can we address this?
I mean, definitely once you have your professionals moving out of the country, it's an issue of concern. But we always have to look at these numbers in the context of the targets that we have. For every country, you expect a natural out-migration, but the question is it consistent with the target relative to the numbers that you are training and the numbers that you expect to be retained in this country? So this is where we refer our discussions to what the policy documents are when it comes to the numbers that we are training, the numbers that we expect to be retained, and obviously the numbers that we don't have control over that would exit. I don't have on top of my head what the statistical targets are on these issues, but definitely going forward, these are some of the contextual discussions that we're going to have, especially in this case.
Is it about the need to train more or to retain more?
The starting question will be, what is the stock of medical professionals that we have? That should be the first question. Then the next question is, what is the number that we require as a country? That is what is going to inform the number that we are training vis-a-vis those that, as I indicated, will naturally move out of the country. So until we do these analysis sequentially, one would be jumping the gun saying that go and train more when we've not had a conversation on the stock that we need and what is required for us as a country.
But is this something you'd be looking at in the coming days?
Absolutely, this is what we are doing at Ghana Statistical Service. We're trying to engage more with the government ministries, department and agencies to get a good sense of what their expectations are. That is why our mantra lately has to do with profiling of policy documents from the perspective of statistical target. And in the case of the Ministry of Health, we have looked at the health sector medium-term plan from the perspective of the demographic and health survey that we did. With the onboarding of the National Human Development Report, we're also going to do same and try to see how what we have in terms of reality aligns with what the statistical targets are.